What a visibly throbbing carotid artery means for your health. Have you ever caught a glimpse of a strong, visible pulse throbbing in your neck? Most of us are used to feeling our pulse in our wrists, but when it's your neck's carotid arteries, the vital blood highways supplying your brain, that are visibly pounding, it can be unnerving. While a subtle pulse here is perfectly normal, especially if you're thin or have just exercised, a pulsation that suddenly becomes very obvious, pronounced, or feels new, particularly if it's localized to just one side or changes with your blood pressure, is a symptom that definitely warrants medical attention. This article will help you understand what causes this visually prominent carotid artery throbbing. We'll explore why distinguishing between its various potential causes, which range from benign anatomical variations to serious cardiovascular conditions, is so crucial. More importantly, we'll discuss the potential health implications if left unaddressed and outline the essential steps for diagnosis and management. What is carotid artery throbbing? The carotid arteries are major blood vessels essential for brain function. A throbbing sensation or visible pulsation refers to the rhythmic expansion and contraction of these arteries as blood pumps through them with each heartbeat. While a subtle pulse can be normal, particularly in thin individuals or during exertion, a prominent, noticeable pulsation can signal an underlying health issue. What is a normal, non-concerning carotid pulse? It's common to occasionally feel your pulse in your neck, especially if you gently press your fingers into the soft hollow area just to the side of your windpipe. For many, a subtle, rhythmic pulsation might even be visible under certain circumstances without being a cause for alarm. A normal, non-concerning carotid pulse typically has the following characteristics. Subtle visibility. It's usually not overtly prominent or jumping out at you. You might see a faint ripple or subtle movement, especially if you are thin, have fair skin, or are lying down in a quiet environment. Symmetrical. The pulsation feels and looks similar on both sides of your neck. Consistent rate and rhythm. It follows your normal heartbeat, usually between 60 to 100 beats per minute at rest, with a regular, steady rhythm. No associated symptoms. There's no pain, tenderness, dizziness, lightheadedness, or other alarming symptoms accompanying the pulse. Brief and transient. It might become slightly more noticeable during periods of physical exertion, emotional stress, or fever, but it generally subsides as your body returns to a resting state. The key distinction lies in a change from your normal state. If the pulse becomes significantly more obvious, persistent, localized, or is accompanied by other symptoms. The significance of a visually obvious pulse. When the pulsation becomes visually apparent, it suggests a more forceful or unusual dynamic within the artery or the circulatory system as a whole. This is especially true if the throbbing is new or worsening, a change from your usual state. Unilateral, one-sided, indicating a localized problem. Correlated with blood pressure, appearing or disappearing with changes in your blood pressure. Potential causes of visually obvious carotid artery throbbing. The causes can range from relatively benign anatomical variations to serious cardiovascular conditions. A. Localized arterial issues, often unilateral. Carotid artery aneurysm. Oh, what it is, a localized bulge or ballooning in the wall of the carotid artery. Imagine a weak spot in a garden hose that swells up when water flows through it. An aneurysm is a similar bulge in a blood vessel. It's visible. If the aneurysm is sufficiently large and close to the skin surface, its vigorous pulsation can be clearly seen as a throbbing lump. Concern, aneurysms are dangerous due to the risk of rupture, causing life-threatening bleeding, or the formation of blood clots that can travel to the brain and cause a stroke. Carotid artery dissection. What it is, a serious condition involving a tear in the inner lining of the carotid artery wall, allowing blood to flow between the layers. Think of it like the inner layer of a tube separating from the outer layer, allowing blood to get trapped between them. It's visible. Changes in blood flow dynamics within the damaged artery or the formation of a pseudoaneurysm, a collection of blood that forms outside the artery wall after a tear, or due to trauma/iatrogenic causes like medical procedures, creating a pulsating false sac, can lead to a noticeable pulsation. Concern, a medical emergency. It can severely reduce blood flow to the brain, leading to a stroke, or cause sudden, severe pain in the neck, head, or face, along with neurological symptoms like weakness or numbness. This requires immediate medical attention to prevent severe complications. Kinked or tortuous carotid artery. What it is, the carotid artery can sometimes develop unusual bends or become excessively winding, tortuous, particularly with age or in individuals with high blood pressure and atherosclerosis. It's visible. The abnormal path can make the arterial pulsation more prominent and visually obvious as blood flows through the curves. While often benign, it might reflect underlying vascular changes or the increased rigidity of the artery wall due to atherosclerosis, making the pulse more easily transmitted. Carotidynia, Fay syndrome/Tippich syndrome. What it is, a rare inflammatory condition affecting the tissues around the carotid artery. It's visible, characterized by unilateral neck and facial pain, tenderness, and an increased pulsation over the affected carotid artery. The throbbing might be exacerbated by head movements or chewing. Carotid body tumor, paraganglioma. What it is, a rare, usually non-cancerous tumor originating from the carotid body, a small cluster of cells located near where your carotid artery splits into two branches. It helps regulate breathing and blood pressure. It's visible. These tumors are highly vascular and typically present as a slow-growing, pulsatile lump in the neck, often on one side. Systemic conditions leading to a bounding pulse can be more noticeable unilaterally. These conditions cause a very strong, forceful pulse throughout the body, bounding pulse, which might be particularly visible in the carotid arteries due to their superficial location or individual anatomical variations. Aortic regurgitation, aortic insufficiency. What it is, a heart valve problem where the aortic valve, the one-way door from your heart to your body, doesn't close properly, causing blood to leak back into the heart after each beat. It causes bounding pulse. The heart compensates by pumping a larger volume of blood with each beat, increased stroke volume, to maintain forward flow. This creates a forceful pulse with a rapid rise and fall, often visibly obvious in the carotids. Hyperthyroidism, overactive thyroid. What it is, the thyroid gland produces excessive hormones, accelerating metabolism and increasing heart rate and contractility. It causes bounding pulse. This leads to a systemic hyperdynamic state, where your entire circulatory system works in overdrive, with blood flowing with increased force throughout your body. The excess thyroid hormones directly increase the heart's pumping strength and rate, leading to a more forceful circulation. Severe anemia. What it is, a significant reduction in red blood cells or hemoglobin, impairing oxygen delivery. It causes bounding pulse. To compensate for the reduced oxygen carrying capacity, the heart works harder and faster, increasing cardiac output, the amount of blood pumped by the heart per minute. This results in a more forceful and often visibly prominent pulse. High blood pressure, hypertension. It's relevant. While not always causing visible throbbing on its own, elevated blood pressure can exacerbate any underlying arterial stiffness, tortuosity, or an aneurysm, making the pulse more pronounced. This is especially true if the throbbing disappears when blood pressure is lowered, indicating a direct hemodynamic influence. Chronic hypertension also contributes to atherosclerosis, which can stiffen arterial walls over time. Heart failure, congestive heart failure, CHF. Oh, what it is, a condition where the heart muscle doesn't pump blood as effectively as it should to meet the body's demands, leading to fluid buildup. It's relevant. In heart failure, especially in early or compensated stages, the heart may try to compensate by beating more forcefully or increasing its stroke volume to maintain blood supply, which can sometimes contribute to a bounding arterial pulse, like in the carotid. More commonly, however, severe heart failure causes visible swelling and pulsation of the jugular veins in the neck. These veins are located slightly more to the side than the carotid arteries and become distended due to blood backing up into the veins leading to the heart, increasing pressure. This engorgement and pulsation are often more noticeable, especially when lying down or with the head slightly elevated. Your doctor will be able to distinguish between arterial, carotid, and venous, jugular, pulsations during examination. Anxiety, stress, and stimulants, intense emotional states like anxiety or stress, or the consumption of stimulants like excessive caffeine, can temporarily increase your heart rate and the force of your heartbeat. This can make your pulse, particularly in the carotid arteries, more noticeable. These effects typically subside once the stress or stimulant wears off, but persistent anxiety or heavy stimulant use can sometimes warrant medical review. Other high cardiac output states, conditions like severe fever or large arteriovenous fistulas can also lead to increased blood flow and a bounding pulse. In fever, increased metabolic demands and vasodilation lead to the heart pumping more blood. Large arteriovenous fistulas, abnormal connections between an artery and a vein, create a low-resistance shunt, causing blood to bypass capillaries and return to the heart quickly, thus increasing the volume of blood the heart must pump with each beat. Why your observation about blood pressure and heart rate is critical. Your observation that the throbbing on your right side is visible at a blood pressure of 120/70/70 mmHg and a heart rate of 70 bpm, but disappears when these are reduced to 110/60/60 mmHg and 60 bpm, for example, by increasing your carvedilol dose from 3.125 mg to 6.25 mg, is a crucial piece of information. This strongly suggests that the throbbing is tied to hemodynamics, how your blood flows and the pressure it exerts throughout your circulatory system, and the forces within that specific artery. Even a seemingly small difference in systolic and diastolic blood pressure, or a moderate reduction in heart rate, can significantly impact how forcefully blood surges through your arteries and how much the arterial wall expands. This indicates that the throbbing may be related to one or more of the following localized arterial factors. Localized arterial characteristics, such as a slightly stiffer, more superficial, or subtly tortuous, abnormally winding, segment of the right carotid artery that becomes more visibly prominent under higher pressure and heart rate. When these forces are reduced, the subtle movement becomes imperceptible. Subtle underlying issues, a very small aneurysm or minor degree of arterial stiffness on the right side that becomes evident only when the arterial system is under slightly more pressure and pumping action. Specific conclusion for your scenario, patient with CHF and unilateral pulsation. Given that you have a diagnosis of congestive heart failure, CHF, and are observing a visible pulsation only on your right side that disappears when your blood pressure and heart rate are lowered by medication, like carvedilol. The visible, unilateral, right-sided, carotid pulse in your case is most likely not a direct primary manifestation of your heart failure causing systemic venous congestion. If CHF were the primary cause of a prominent neck pulse, it would typically appear bilaterally, reflecting fluid backup in both jugular veins. Instead, your specific observation overwhelmingly indicates a localized anatomical or functional characteristic of the right carotid artery that becomes visually apparent only when the hemodynamic forces, blood pressure and heart rate, are at a higher threshold. The successful reduction of these forces by increasing carvedilol made the pulsation disappear, which provides compelling evidence that the visible pulsation reflects a dynamic interaction between local arterial characteristics and your body's overall blood flow and pressure, rather than a static lump or a pulsation related to your heart failure's effect on your veins. Therefore, even with a CHF diagnosis, the focus for this particular symptom would be on investigating a localized issue within your right carotid artery, such as a kinked or tortuous vessel, a very superficial artery, localized stiffness, or a subtle, small aneurysm. Your careful observation of how your pulse responds to medication changes provides invaluable clues for your healthcare provider. The importance of diagnosis. What could go wrong if untreated? Ignoring visually obvious carotid throbbing, especially if it's new, unilateral, or associated with blood pressure and heart rate changes, can lead to serious consequences depending on the underlying cause. Stroke or transient ischemic attack, TIA, the most feared complication. Conditions like carotid dissection, aneurysm, or significant plaque buildup, atherosclerosis, can lead to blood clots breaking off and traveling to the brain, causing permanent brain damage, disability, or death. Heart failure, untreated systemic conditions like severe aortic regurgitation, chronic anemia, hyperthyroidism, or even heart failure itself if not properly managed, can continuously overwork the heart, leading to its weakening and eventual failure. Aneurysm rupture. A growing carotid aneurysm could rupture, causing life-threatening hemorrhage in the neck or brain. Progressive neurological symptoms. Conditions like carotid dissection or large carotid body tumors can compress nearby nerves, leading to persistent pain, numbness, voice changes, or difficulty swallowing. Worsening underlying disease. If the throbbing is a manifestation of an untreated systemic condition, e.g., uncontrolled hypertension or hyperthyroidism, that condition will progress, leading to broader health issues like heart attack, kidney disease, or cardiac arrhythmias. What you can do. Non-invasive steps to support artery health. While the specific cause of a visible carotid pulsation needs to be diagnosed by a doctor, many of the underlying issues that contribute to arterial problems are related to overall cardiovascular health. Even if your artery's appearance is due to a natural bend or superficial location, maintaining good heart and vessel health can help manage the forces within your arteries. These non-invasive strategies are beneficial for everyone, especially those with existing cardiovascular conditions like heart failure. Manage your blood pressure. Since your pulsation became less visible when your blood pressure lowered, this is a key area. Follow your doctor's recommendations for medication. Take prescribed blood pressure medications, like carvedilol, in your case, exactly as directed. Reduce sodium intake. Limit processed foods, canned goods, and restaurant meals, which are often high in salt. Eat a DASH-style diet. Focus on fruits, vegetables, whole grains, lean protein, and low-fat dairy. Limit alcohol. Excessive alcohol can raise blood pressure. Control your heart rate. As advised by your doctor, medications like beta blockers, carvedilol, are specifically prescribed to help manage heart rate and the force of heartbeats, which directly influenced your visible pulsation. Adhere to your medication regimen. Do not adjust doses without consulting your doctor. Improve cholesterol levels. High, bad cholesterol, LDL, contributes to plaque buildup, atherosclerosis, which can stiffen and narrow arteries over time. Eat a heart-healthy diet. Reduce saturated and trans fats found in red meat, fried foods, and processed snacks. Increase intake of healthy fats, from avocados, nuts, olive oil, fatty fish, and fiber, fruits, vegetables, whole grains. Take prescribed cholesterol-lowering medications, if recommended by your doctor. Quit smoking. Smoking is one of the most damaging things you can do to your arteries. It directly harms blood vessel walls and accelerates plaque buildup. Quitting is a single most impactful step for vascular health. Maintain a healthy weight. Excess weight increases the burden on your heart and can contribute to high blood pressure, high cholesterol, and diabetes, all of which negatively impact artery health. Engage in regular physical activity. Aim for at least 150 minutes of moderate-intensity aerobic exercise per week, e.g., brisk walking, swimming, cycling. Exercise helps lower blood pressure, improve cholesterol, manage weight, and strengthen your heart. Always discuss new exercise routines with your doctor, especially with existing heart conditions. Manage stress. Chronic stress can contribute to higher blood pressure. Practice stress-reducing techniques like meditation, deep breathing, yoga, or spending time in nature. Control blood sugar. If diabetic, high blood sugar levels can damage blood vessels over time. If you have diabetes, work closely with your doctor to keep your blood sugar in your target range. These lifestyle changes are powerful tools in promoting overall vascular health and can help slow the progression of artery problems, regardless of their specific nature. They complement any medical treatments your doctor prescribes and are essential for safeguarding your long-term well-being. What to expect at your doctor's appointment. When you visit your doctor about a visible neck pulse, they will gather a detailed understanding of your symptoms and overall health. You can expect them to ask detailed questions. They'll want to know when you first noticed the throbbing, if it's on one side or both, if it changes with your blood pressure or activity, and any other symptoms you're experiencing, like pain, dizziness, weakness, or shortness of breath. Be prepared to discuss your medical history, including any pre-existing conditions and medications you are currently taking. Perform a physical exam. This will include checking your vital signs, blood pressure, heart rate, listening to your heart, and using a stethoscope to listen over your carotid arteries for any bruits, abnormal whooshing sounds that can indicate turbulent blood flow, often due to narrowing or tortuosity. They will also assess other areas of your body for clues, such as swelling in your legs, which could point to a systemic issue like heart failure. They will specifically attempt to differentiate between an arterial, carotid, and venous, jugular, pulse. Discuss next steps. Based on their assessment, they will recommend specific diagnostic tests to identify the cause of your symptoms. By preparing a list of your symptoms, medications, and any questions you have, you can help your doctor make the most accurate and timely diagnosis. Necessary tests for diagnosis. Given the range of potential causes, a thorough medical evaluation is essential. This typically involves comprehensive medical history and physical exam. Your doctor will inquire about your symptoms, medical history, and perform a physical exam, including listening for bruits, abnormal whooshing sounds, over your carotid arteries. Carotid duplex ultrasound, Doppler ultrasound. This is usually the first-line imaging test. It's non-invasive and uses sound waves to create images of your carotid arteries and measure blood flow. It can reveal plaque, narrowing, kinking, aneurysms, or dissections. This test would be particularly important to evaluate the right carotid artery in your case. CT angiography, CTA, or Mr. Angiography, MRA, of the neck. These are advanced imaging scans that use X-rays, for CT, or strong magnets and radio waves, for MRA, to create very detailed pictures of your blood vessels. A special dye might be injected to make the vessels stand out better. These are often used if the ultrasound findings are inconclusive or if more detail is needed. Blood tests, to check for systemic conditions that can cause a bounding pulse, such as O-complete blood count, CBC, to rule out anemia. O-thyroid function tests, TSH, to check for hyperthyroidism. O-lipid panel, to assess cholesterol levels, a risk factor for atherosclerosis. O-brain natriuretic peptide, BNP, a hormone released by the heart in response to stretching of the heart chambers. Elevated levels can support the diagnosis or monitoring of heart failure severity. When to seek medical attention. If you notice a new, significantly increased, or visibly obvious throbbing in your neck, especially if it's confined to one side or changes with your blood pressure and heart rate, do not delay in seeking medical evaluation. Contact your doctor's office promptly. Seek immediate emergency medical attention. Call 911 or your local emergency number, if the throbbing is accompanied by sudden, severe pain in the neck, face, or head. Sudden weakness, numbness, or paralysis, especially on one side of the body. Difficulty speaking or understanding speech. Sudden vision changes, blurred vision, loss of vision in one eye. Sudden dizziness, loss of balance, or confusion. Trouble swallowing. Shortness of breath, especially when lying flat. New or worsening swelling in your legs or ankles. While some causes may be benign, others are serious and require prompt diagnosis and treatment to prevent potentially life-altering or life-threatening complications. Your careful observation of this symptom is a valuable clue for your healthcare provider. Final conclusion. Visually obvious throbbing in the carotid artery is more than just a peculiar sensation, it's a critical signal from your body that should not be overlooked. While the observation might initially cause concern, its dynamic nature, particularly if it appears or disappears with changes in blood pressure and heart rate, and is limited to one side, such as the right-sided pulsation discussed in this article, provides invaluable clues to healthcare professionals. Identifying the root cause, whether it's a benign anatomical variation, a specific localized vascular condition like an aneurysm, dissection, or tortuosity, or a systemic issue affecting the heart or metabolism, such as hyperthyroidism, severe anemia, or even certain aspects of heart failure, is paramount. Early and accurate diagnosis, supported by your detailed observations and comprehensive medical evaluation, allows for timely intervention. This can range from simple monitoring and lifestyle adjustments to more complex medical treatments, ultimately preventing serious and potentially life-threatening complications such as stroke or heart failure. Therefore, if you notice a prominent, visible pulse in your neck, especially if it's new, unilateral, or fluctuates with your blood pressure and heart rate, make an appointment with your doctor. Understanding this symptom and seeking timely medical advice are the first essential steps towards safeguarding your long-term health.